September Skincare Awareness Month, and we asked Dr. Melanie Kingsley several of the most common questions she gets as the Director of Cosmetic Dermatology and Laser Surgery with MK Dermatology. But there was so much to talk about. We ran out of time, so we brought her back, Dr. Kingsley, to continue this conversation because I started asking you all these questions. I'm like, wait a minute, I have like 20 more, so let's keep the conversation going because I would think that I know I'm going to wash my face every night and every morning, but not everybody does, and not everybody knows if they need to. What do you say?
I typically recommend washing every night and every morning because imagine all the oils, the dirt, any makeup or sunscreen you have on your face.
Yeah.
It's in the pores. You want to wipe that away before going to bed at night. And then at night you develop your own natural oils on your skin. So you're going to want to wash that off in the morning before more oil and dirt gets on there. So I do recommend a twice-a-day washing, but with a gentle cleanser. Don't strip the skin. Make sure you moisturize after, because if you overwash and dry out the skin, that's when you're going to harm the skin.
Men and boys as well, not
Yes.
just women?
Yes, and men and boys can take a little more because they have a little more oily skin. But yes, I recommend it because especially men that don't like to do it, just do a quick rinse if you can.
Okay, now we talk about things you recommend. What is micellar water? We've been hearing this come up a lot. What is it, and do you recommend it?
So micellar water has been around for a while, but it is a new trend. My 10-year-old daughter swears by it. So I took some of hers a couple weeks ago and used it in place of a makeup remover pad. It's really nice. It's very soothing. It cools, it cleans the skin well. And what it is it's purified water, some moisturizers, and then some skin surfactants, which are cleansers. And those skin surfactants come together and form micelles, which help pull that dirt and oil out of the skin. So it's a great way without all the chemicals to gently cleanse all of the skin off. And
I like it that your daughter's like, because of what you do for a living,
Yes.
she's probably like, okay, well, I think this is working,
She is.
Mom. What do you
She
think
is.
about this? So when it comes to moisturizers, I'm using a much different moisturizer in my 50s than I did in my teens. So let's talk about, how do you know which one is the right one for your skin and at your age?
So a lot of women, as we get older, even men, our skin just gets drier, and that makes us age a little faster. So you need different moisturizers, different makeups. But the key is one question I get most often is, what if I get acne and I want moisturizer and I want anti-aging? So that's kind of where I developed my Camu line, where you have all your anti-aging, your vitamin C, your hyaluronic acid, your niacinamide, but also you get the acne fighting agents such as glycolic acid, lactic acid, malic acid. There's one called gluconolactone on there that's like a benzoyl peroxide but gentle. So it is targeting acne, it's targeting anti-aging, and then the ceramide addition helps moisturize. So to answer your question overall, when you are aging, your skin's more mature, you want a good hydrator. But if you're acne prone, you want to make sure it says oil free or non-comedogenic. Look in your makeup, look in your moisturizers, make sure it is that, otherwise you'll cause yourself to break out with all that hydration.
Yeah, and good. I'm getting the wrap, but quickly, so I didn't get to this the last time either. Kids, when it comes to like a teenage boy or girl, is there one moisturizer that maybe is in your line or one that you recommend that they should be using, or is it different for every kid?
It's different for everyone, but I do recommend wearing one with ceramides to help hydrate the skin. So gentle cleansers for the kids, very simple regimen. They don't need much, but if they do have acne or the keratosis pilaris, the dry itchy bumps or that can get on the cheeks too, make sure you're using something with ceramides to help.
Ceramides?
Yeah, the ceramides are in the natural skin barrier, so it helps strengthen the skin barrier.
I could talk forever. Okay, every time we talk, we go long. Fox59.com/links. Again, Dr. Kingsley is her name, MK Dermatology. Jim, folks just might want to reach out to her directly.
All right, Angie, good advice there. Heading